My name's James Vance. I am the Senior Program Manager for the Prevention Policy Branch within the Health Promotion and Chronic Disease. And I manage, basically I manage the obesity funds that the state gets from the CDC, from the state, and from, we actually just got some money here recently from the NACDD to do work in specific counties in southern West Virginia. But one of my fun things that I really love to do is worksite wellness. I'm the coordinator for DHHR Wellness Program for DHHR, and we have over 6,000 employees statewide. So it's kind of hard to manage wellness programs that you have to spread across the state and try to do remote work with sites that are, not close to where you're working. So, we have to do individual planning sometimes for our site and statewide. And I asked my state trainer, not state trainer, but the trainer that trained me to be a master work at health trainer, what should I talk about today about worksite wellness? And she said, James, always tell your story. And some of you know my story in the room already, but I used to weigh 430 pounds. And through worksite wellness programs, specifically one that's really great with PEIA, it's called the Weight Loss Management Program. And I joined that, and I was able to lose over 230 pounds within a year and a half in that program. But of course, as we all know, life sets back, and I had my brother passed away, and it really affected my emotions. And I put on back about 100 pounds of that. And with another worksite wellness program, the National Diabetes Prevention Program we had at work, I was able to lose that 100 pounds I put back on and just a little bit more. So through worksite wellness and worksite wellness programs, I was able to lose the weight and keep it off. And so I always like to plug those worksite wellness programs that are life change programs that really help you lose weight or control your diabetes or anything that you're trying to manage. But to get on to with the awards, I'd like to just say a little bit how we picked the awards for this year. We looked at your work at health, if you're work at health certified, how many employees you had that were work at health certified. We looked at your end of the year reports and your middle of the year reports. We also looked if you filled out for a mini grant. You're really aware of the good example contract that we have on there that you have to check off some things. So we looked at those and some other things that we looked at for the criteria to pick these awards. And when I call your name, if you would come up and just say a few things about your wellness program at your work and some of the things you're excited about doing. I'm going to start off with our Honorable Mention Award, and that award goes to Boone Memorial.
Thank you all very much. I'm very appreciative of this. We're new in the workplace wellness program arena. We started out with wellness in 2017, thanks to Jessica and a grant that we received from the chronic disease. And we started the diabetes prevention program. I am a nurse practitioner at Boone Memorial. I was a nurse for 16 years and loved taking care of people, making their lives better, and thought, well, gosh, I'll go ahead and be a nurse practitioner and do that even better. Well, I was a round peg trying to fit into a square hole, or the other way around, because I want people to be well and to prevent illness. And as a medical provider, you have 15 minutes to see them and you write in prescriptions and send them out the door. So I don't like that. So now I'm totally into wellness education, and I'm so thankful for all of you all, because without you all, I could not do my job as I do now. So thank you very much.
And our bronze award this year goes to Hometown Elementary School.
Well, I'm the principal at Hometown Elementary School. This is my 9th year there. Before that, I taught 3rd grade. And with the pandemic this year, it has been a struggle for staff, because if you know a teacher, you need to thank them, because they were thrown into an arena of training themselves while trying to train students. So to say my staff was stressed out is an understatement. So we wrote this is our first try with the wellness grant, and we got $1,000, and the staff decided they wanted yoga. They are actually having a yoga class this evening at 3 o'clock that I'm missing. But we got a certified yoga instructor who comes to our school and trains us 1 day a week, and then we go to her studio for Pilates or TRX or yoga, and everybody is loving it. Then the teachers also got trained in kidding around with yoga, so we're doing yoga with the kids at school. The PE teacher does it every day. The classroom teachers do it as brain breaks. And then we did Minds in Motion. So we have a sensory room that we've set up for the kids, and we have a sensory walk down the hallway. So we're trying to meet their social and emotional needs because we can't meet the academic needs until we do that. So thank you all.
Thank you, Tracy. And before I announce the Silver Award, I just want to talk about why this worksite got a Silver Award. Every other month I have to set in work at health classes or work at health meetings with the CDC and NACDD. And West Virginia is actually one of the star states in work at health. We have more work sites trained in work at health than any other state. We have more work at health employees than any other state. And we also have more T3 trainers than any other state. And West Virginia. And during those discussions with these webinars, the CDC was really impressed with this school or this work site with the story that they have put out there. And they're really excited about doing a story about this work site, and they're doing a story about West Virginia. So I'll share that with you when it's published through the CDC newsletter. But the Silver Award goes to Clay Middle School.
I want to first say what she said, because that, normally we do activities after school with the kids, and this year the kids weren't allowed to have any activities. The teachers were so stressed. We were learning, they threw 2 days before school started, they said, oh, you're going to be teaching virtual school, as well to teaching your students in person and virtually, which is what we call remote. And plus, we don't have internet that works for a hoot in Clay County, so we had to also prepare everything as pencil paper and then get that stuff back and grade in. It was so stressful. And every time we'd see the teachers, it was just like so stressful. And I said, we got to do something. Everybody's talking about gaining all this weight while they're home, sitting on a couch, grading papers, trying to use the internet that doesn't work. So I thought I saw in a Try This newsletter, I saw Active Southwest Virginia. And I called and talked to Veronica because I was thinking, boy, I sure would like to do something for our school. We have a brand new rail trail, the Elk River Rail Trail, and it's gorgeous. Nobody goes on it. They're one place they're scared of bears, one place they're scared of the vagrants, another area they're scared of dogs. And I'm like, and they haven't even explored it. And I'm like, oh gosh, how can we not? So I called Veronica, and I wasn't going to do it. I was like, and she says, oh, you should do it. So we embarked on a plan to use the Elk River Rail Trail for walking and biking and hiking and kayaking, all kinds of things. And in the process, and this is probably the biggest deal for you, is that we now have a workplace, because it's not me, it's my friend Michelle, that got certified as Work at Health. We have a Walk with Ease trainer who's certified. So these are programs that's going to make this sustainable and let us keep going. We've got discs for our new disc golf course that nobody uses, and we have people now that know how to play. So it's like it's going to be good. And we have a fitness class that's going on today. Yeah, it's going on today as we speak. So, and people are asking, let's do this. Let's have this. We need to learn about nutrition. So we have a committee and a place to go, and we have support from our principal. So we're like really, really happy. I'm happy because I need motivation. I need people.
Thank you. And before I announce the last award, I'd like to talk a little bit about this worksite. This worksite has been in our mini grant program for 2 years. They have done great and wonderful work. One of the things I would really like to highlight is they passed a healthy meetings food policy, so they are assured to have some healthy food at all their meetings they do at this worksite. And the gold award goes to Coplin Health System.
Hello, everyone. My name is Jenna Carr. I'm with Coplin Health Systems. We are a federally qualified healthcare center, and we serve the underserved. We tend to forget sometimes about ourselves, and I know today we spent a lot of time reflecting about employee satisfaction, employee engagement, and really focusing on how we can better our work environments, because I think that's a direct reflection of what services we can provide. So like James said, one of the things we did, I actually went through the work at health training with another employee, and we became certified, which was fantastic. The dice are amazing. During COVID, it was fun because we threw them, but we wouldn't let them touch the floor. So we were like, grab them, what does it say? So over the past 2 years, we have developed a pharmacy, which is FARMACY, and it has grown and developed from me coming from a hospital environment, knowing nothing about grants, writing a little grant, getting a little bit of money, and able to offer it at my site to this year we're able to offer it at all of our locations in Woodward, Jackson counties, and serve not only the public but also our employees. So we are very, very thankful for all of the partners and the collaborations and the support. Sam and her team are doing a fantastic job providing data for us. The Mid-Ohio Valley Rural Health Alliance helps support us. Carrie and Becky at the health department are amazing people to work with too. And we just keep on going, finding new ways to implement things. We're doing the walk challenges, giving people incentives. Staff is becoming more engaged. And part of our strategic plan this year is to improve employee satisfaction. So that not only comes from, oh, let's give people more money. It's also, I'm happy to be at work. I'm happy to be in this environment. So we're truly thankful for everything everybody has done. And we're hoping just to continue to grow and strive, and become something. So thank you.
Thank you. And before we end, I just want to let everybody know next year we will have the date for this conference set probably within the next week or so. So you'll get a save the date for next year's conference, so it won't be as hard to fit it in your schedule. And we look forward to hope everybody in the room applies for a grant this year coming up. The mini grants help a whole lot with things you may need if you need incentives or any type of activities that you need to use that money for. So we encourage everybody to apply for the mini grant coming up for next year. Thank you.
Thank you, James. And a few folks you know who you are. We'd also like to recognize our facilitators and the planning committee, all the folks that helped make this conference possible. It was such an exciting and scary decision to decide we were going to do this in-person event and to put it all together kind of quickly, not knowing what the future was going to hold with vaccines and COVID diluting a little bit. So Melanie's going to be walking around. If you helped make today possible, she's got a little gift for you. I hope y'all are enjoying your cheesecake still. Once Melanie's got those passed out, we have one more recognition we'd like to make that I will not tell you who that's for yet. And then we'll get on to the second half of our afternoon.
Hey James, it's Lisa Irk. I'm so proud of you. Congratulations. Thanks for all you do. You're a rock star.
Hey James, thank you for all you do and the great impact you have on all of our health. Congratulations.
Hello everyone. I'm proud to be here help to recognize James Vance and all these great accomplishments. I first met James when he helped to raise our kids. He was part of the after-school and summer school program out at Cross Lanes Elementary, and he was an instrumental person in the lives of not only the kids but parents as well. James also should be recognized for his certification as a wellness trainer. This is a accomplishment that few across the country, much less West Virginia, have obtained. James should be recognized for running and keeping the wellness program for DHHR and the Bureau going. James should certainly be recognized for his own personal wellness, his weight loss, his dedication, his commitment to his own personal health. So there's many things that I could quote to recognize you, James, but I'm going back to 1996 and a youth musical that was out then called James and the Giant Peach. In there's a quote that says, the wonderment of the world hasn't even begun to be thought about yet, but it is so very important to think about. So James, you keep thinking about all those great things that you want to do around wellness and just go for it. It'll only benefit yourself as well as all of us folks around the West Virginia and the folks around the region. So thanks for what you do and all you do. And we love you and appreciate you, brother. Be well.
Yes, so thank you again, James, and we couldn't do all this without you. Look forward to many more years to come of workplace wellness in West Virginia.